I know we've been talking about COVID-19 issues for now over a year, but there's still some more important issues to deal with, and it's important to get current with where we are. Couldn't be more fortunate than to do this together with the Department of Health and Human Services here in Nebraska. This year, Nebraska's managed this process very, very well, I would say. And the Department of Health and Human Services has been at the forefront of that and has done an incredible job. We're going to talk a little bit about vaccinations and about where we are at this point. And then we're going to have Mark Shore, a labor law attorney, help us talk about the employer-employee side of this a little bit. In today's event, we'll have a couple opportunities for questions and answers. What I would encourage all the audience to do is type their questions into the Q&A. I'll be monitoring that, and we'll get questions to our speakers today. So let me start with, I'm very fortunate to introduce Danette Smith. She's the CEO of the Department of Health and Human Services here in Nebraska. She was appointed CEO of DHHS in February of 2019. She brings more than 25 years of executive leadership in large, complex organizations to the state. Specifically, prior to joining the Nebraska Department of Health and Human Services, she was director of the Virginia Beach Department of Human Services, and she's also worked in leadership capacities at virtually all over the United States. I'm looking at the list here, Seattle, Atlanta, Charlotte, and Cook County, Illinois. Very experienced. We're very lucky to have Danette in that position in Nebraska. She holds a Bachelor's of Science degree in psychology from Eastern Michigan and a Master's of Social Work from the University of Illinois at Chicago. And she has two daughters whom she loves dearly, I'm told, and they reside in North Carolina, and her dog, Mr. Bentley, which is probably the most important person in the family, if it's like our family, enjoys traveling the country with her. I know everybody at the Chamber has really appreciated working with you over the past year. You've been a big help to our employers, and very happy to have you on the presentation today. Could you just kind of give us a sense of where the vaccination program is now and what you're thinking?
Well, Brian, thank you so much for having Dr. Anthon and I here today. And I'm excited to just let you know where Nebraska is ranking. We believe that we're doing an excellent job with getting and administering the vaccine. As you are aware, there are 3 vaccines that we've been working with. That's Pfizer, Moderna, and right now, the state of Nebraska, along with the other 50 states, have put the Johnson & Johnson product on hold. If you look at our data from the New York Times, we are doing an excellent job in administering the vaccination. And in the New York Times, we ranked 21 in the country, and we went as high as to 10th in the country with our vaccination program. We also ranked, which is the most important number, 14th in the country according to the CDC and vaccinations. More than 211,000 persons were given the vaccine last week, and so we're just excited about the number of people who are deciding to get vaccinated. I always like to remind people that getting the vaccination is just an extra, you can go to the next slide, please, that the vaccination is just an extra layer of protection. We always encourage you to do the non-pharmaceutical interventions, which is wear your mask, wash your hands, stay 6 feet apart, and as much as you can, be in small groups. If you can, with the weather being better, we want you to be outside. Next slide. Next slide. So as many of you know, the state of Nebraska over the last 60 days developed what we call vaccinate.ne.gov. That is our web portal that allows Nebraskans to register and be contacted by their local health department around getting vaccinated. As you can see from this data, approximately 372,000 Nebraskans have gotten registered and probably been contacted by their local public health department. We also thought that it was important for you to see the average age of those who are registering. So those of us who are in that baby boomer category, and I have some more data I'm going to share with you, we are registering and we're getting vaccinated. We have made sure that our vaccination.ne.gov not only is available to persons that speak English, but we also have a prompt on that website that allows persons that have a different language, perhaps Spanish, to be able to register online to the portal. But in addition to that, we've made telephonic communications available. You will notice on this slide that there's two numbers there. One is a local number, one is a toll-free number. I have a call center available to assist persons with registering in the vaccinate.ne.gov. So as you are working with your employees and employers, please give them the phone numbers that can be utilized as a way to communicate with DHHS to get registered, again, on vaccinate.ne.gov. Next slide. In Nebraska, as of yesterday, and Brian, just want you to know that I drive my staff crazy because we are looking at data every single day, almost every single hour, and they just want to shoot themselves in the head, but they do a wonderful job. So in Nebraska, as of yesterday, a total of 552,000 Nebraskans have been vaccinated. What does that mean? That's 37.2% of our population in Nebraska are vaccinated. We have 1.586 dosages that have been allocated to the state of Nebraska, and the good news is that we've administered 1.2 million of those dosages, which represents 81.7% of all of those allocations have been given to Nebraska. Hence why our numbers are looking so good with the CDC and with the New York Times, because we are aggressively getting the word out to the community about the importance of vaccination, where you can find the vaccination in your community. And as you know, we are now in 2B, which means anybody 16 and older are available, can get the vaccination. So we just want to put that out there. 2B is the phase that we're in. 16 and older persons can become vaccinated. Thank you. And so I thought I would share a little bit of additional information, and I'm going to run through my next two slides very, very quickly. Wanted you to know that at least for the first shot, at least for the first injection, 80.8% of persons 65 and older have gotten at least the first shot. For the population between the ages of 55 and 64, and in the state of Nebraska, we're at 56.6. And for the population ages from 45 to 54, we're at 48%. And then after that, 16 to 44 years old, we're at 33%. So this information that I'm sharing with you says that at least most Nebraskans have gotten that one shot, which is most important. When we look at information from a racial perspective and cultural perspective, I am very happy to announce that in our community, African Americans are at least partially and fully, well, fully is blue, is 21% of African Americans in the state of Nebraska have been fully vaccinated, with only 13.2 partially vaccinated. We recognize that for Native Americans, we are seeing about 16.9% of those persons being fully inoculated, but we know that there's other data from IHS that we don't have, and we believe that that number is higher than 16.9. For the Hispanic category, approximately 19.9% of the Hispanic community have been inoculated, with approximately 17.8 have been partially inoculated. I share this with you because in our Western communities where we have some African Americans, but perhaps more Hispanics, there is some interest in who's being vaccinated. I'm going to ask you to go right back to slide 6, if you could, where we talk about the number of positive cases. And I'm not going to read this off to you, but you can see that the number of positive cases in Nebraska is 217,000. We have experienced approximately 2,200 deaths here in Nebraska, and our hospital capacity right now is 163. I know that Dr. Anthon is going to talk more with you about the hospital beds and ICU beds and the variances, and certainly after Dr. Anthon's presentation, we'll be prepared to answer any questions. Thank you so much. And I'll turn it over to Dr. Anthon.
So if I might, Doctor, I have to give you an introduction, some formal and some informal. So for everybody's information, Dr. Anthon is the Chief Medical Officer and Director of Division of Public Health. We borrowed him from private surgical practice in Omaha, where he was a faculty member at the Department of Surgery at Creighton University. And prior to that, he was Director of Bariatric Surgery at Methodist Hospital in Omaha and at the University of Southern California in LA. He holds a Bachelor of Arts in Biology from Benedictine College in Kansas, and he earned his Master's of Science and MD from Creighton University. The informal part of this, Doctor, is I remember at the very beginning of this COVID outbreak, the governor held his first news conference on COVID. And I'm not sure why I got invited. But I remember the best part of that news conference was when I walked in the room and I realized that you were there, and at least there was one of us that knew what he was talking about. So, and ever since then, you have been very much a steady voice in this process, and much appreciated by Nebraska, certainly by the businesses in Nebraska, for all the contributions you've made this year. So Doctor, I'm going to turn it over to you.
Thanks, Brian. It's been an honor and a privilege to serve the state of Nebraska. One of the reasons my wife and I and family moved back to Nebraska, because we knew we could make a difference here, and now God has given us this opportunity. So thanks for that introduction. If you can go to the next slide, please. The metric that we always use is our North Star, our guiding star for how we're doing in the state of Nebraska, is how many people are in the hospital. We found out early on that we could sort of manipulate how many people were getting tested by offering testing opportunities, and then we could manipulate how many people were testing positive by saying only certain people were able to get a test. So, but one thing you can't manipulate is the number of people that are coming into the hospital. And so we've used this metric ever since the beginning of the pandemic. And this graph shows, it begins back in June 21st of 2020, of how many people statewide are in the hospitals. And we had sort of a surge back in May of 2020 when our meat processing plants started having some outbreaks. But then we started going down, and we were really thinking we would never see a surge again. And then right around the end of September, early October, you can see how our hospitalization rates rose to right around Thanksgiving time. We reached close to 1,000 patients statewide in the hospital. And this was obviously because we were seeing a regional effect here. All the surrounding states were seeing the same thing. And we became somewhat concerned. And then right around Thanksgiving time, we had 18 consecutive weeks of a decline in patients in the hospital statewide up until 2 weeks ago, where you could see right around the middle of April of this year, we started to see a surge or a little spike in hospitalizations again. And now we've sort of reached a plateau. We couldn't have asked for better timing as far as having the vaccines become available, because this is probably what's preventing us from going into our second surge or our second spike. The solid line is the actual number of patients in the hospital, and the dotted lines are patients that are in the ICU, and the dashed lines are the patients in the ICU that are on ventilators. So you can see how things have progressed over the time period since June of last year. If we go to the next slide, you can just see how many people in Nebraska we have tested. In the orange line, we've tested about 53% of the Nebraska population. And these are just people, these are unique individuals. These aren't people that have tested multiple times. So once you run into somebody in Nebraska, you can count that maybe 1 out of 2 times that person has probably had a test. In the orange line, or the yellow line, you can see the number of people that have tested positive. So right now, we're right around 11.5% of people that get a test that test positive. And then the purple line is what we call our test positivity rate, and that is what is the number of people that get tested that that for that day or that week that our positivity rate is. So you can see how things have sort of plateaued as far as our test positivity rate. We had a little bit of a spike in the beginning of April, starting to plateau again. The other thing I was going to speak about now, we're on the vaccines and our variants. So if we go to the next slide, I was fortunate enough to go to the White House Summit back in December before the vaccines were rolled out. And one of the questions that was asked was, how did we develop these vaccines so quickly? And it's because they're based off two different platforms that we already had a basis for. And the first platform is called a mRNA, messenger RNA platform. It's unbelievable technology. But as we all know, the coronavirus has these spike proteins. This is what makes it look like a crown. There's these proteins that are on the surface of the virus that actually allow it to attach or bind to our own cells. Scientists have developed a sequence of this mRNA that specifically only codes for the spike protein on that virus. They put that mRNA sequence in a lipid coating, and then that's what the vaccine is. So step 3 is once it's inside your body, that messenger RNA then codes for this spike protein, and these spike proteins are then what our immune system develop antibodies to. So that when we see the virus again, these antibodies have already been available in our body and can now neutralize the virus. The next slide shows the different platform that they're using. So that first platform, the mRNA viruses, were for the Pfizer and the Moderna vaccine. And now we have what's called an adenovirus vectored vaccine, which is what the Johnson & Johnson vaccine, the AstraZeneca vaccine, and one that they use in Russia called Sputnik vaccine. Same type of mechanism. They put the gene sequence for the spike protein in an adenovirus chromosome that is not able to replicate, but it can replicate for that spike protein. And that spike protein, once it's developed in your body, we develop antibodies against it, and that's what neutralizes that virus. So two different platforms for those two different vaccines. If we go to the next slide, we really thought we had things under control. I saw this was just in the newspaper last weekend. I thought, I've got to make this slide because this says 1,000 words in one diagram. We thought we had the vaccines developed. We thought science was going to take care of everything. And then look off to the side, the variants are coming out. And so these variants are something that we expect, but I'm just going to speak a little bit about what we're seeing here in Nebraska as far as the variants are concerned. If we go to the next slide, the reason these variants happen is because all living organisms replicate. When they replicate, mutations can form, but since viruses replicate so rapidly, they can mutate a lot faster than any other species. So the mutations that are taking place and that are causing these variants are mutations on these spike proteins that are on the surface of the virus. And if we go to the next slide, you can see why that's important. These spike proteins are what allow the virus to attach to our cells, the receptors on our own cells, and these mutations make it easier for the virus to attach to our cells, get the messenger RNA into our cells, and replicate. So that's why they're of concern. They can increase the risk of getting that cell infected and then causing maybe even a more lethal type process for your disease. If we go to the next slide, please. You can see these spike proteins in a 3D form, and if you notice up in the right-hand corner it says 501, that's the area of this spike protein that is where these mutations are happening. So even though we're seeing these mutations, the vaccines we have are still recognizing the spike protein in general because not the whole morphology or the shape of that spike protein is changing, just that one area. But that one area is enough to make that virus more transmissible and more lethal in some cases. So if we go to the next slide, the first variant that really we identified or became of concern was the so-called United Kingdom strain. And this happened around September of last year, and then it multiplied in the UK and became the most dominant strain of the coronavirus in the United Kingdom in December. We knew it was only a matter of time before it would spread throughout the world, and that's what's happening now. So currently in the state of Nebraska, we've sequenced 354 of these strains of the UK strain, also called the B117 strain, and it is more infectious, transmissible. If you can look at the right-hand side of the slide, about a 1.5 times more transmissible for the UK strain than it is for the wild-type strain. We didn't know this at first, but now we know it. It also causes a more severe infection. Fortunately, the vaccines we have cover this variant, and the testing platforms that we have to test for the variants are all able to detect these variants at this time. So if we go to the next slide, you can see that we also have identified other variants here in the state of Nebraska. The UK variant accounts for a little over 80% of all the variants we have. I was told by our epidemiologist yesterday that of the variants that we're sequencing, or of the tests we're doing, about 70% of the tests now are some form of a variant. And of that 70%, about 80%, 85% are that UK variant. But we're seeing them come from other areas of the world now. Brazil, now we've identified 7 cases. South African variant, 2 cases. California variant, 58 cases. And the New York variant, 2 cases now. So why do we even want to be concerned about these variants? If you can go to the next slide, please. The reason is that if you've been infected before or have a vaccine, are these variants going to make you able to get reinfected again? Or if you get the vaccine, is it going to work? So we keep track of what we call these reinfections, people that have had test positive in the past that now have tested positive again. So we're keeping good track of this data so we can see how these variants are infecting people getting reinfected and needing to go to the hospital or even dying. Now, so far, we've had 4 people with reinfections need to go to the hospital, but luckily, so far, no deaths. And of people that have been vaccinated, fully vaccinated, and developed the antibodies, had 2 or more weeks to develop antibodies, we've seen 74 people that have had completely, fully vaccinated antibodies. We've seen 74 of those patients get these vaccine breakthroughs. And of those, 4 have gone to the hospital, but so far, no deaths. And just a last slide here, Brian, is the reason we're concerned about this is we know these variants were going to happen. It's the natural history for all living organisms, specifically viruses and bacteria. We know they want to be more transmissible and maybe cause more disease. So until we get the certain proportion of the population in the world vaccinated or immune, we still have to stress that until that happens, wearing a mask and washing your hands and keeping your distance is still the practice that we should do until we're all fully vaccinated or immune. So I'm going to end it there, Brian, and Danette and I'm sure we'll be able to answer any questions that you guys want to ask.
So let me thank you guys. That was really good because, you know, I must admit I'm one of those people, doctor, who reads about the variants and I don't know what to make of it. That was probably the most enlightening discussion about variants that I've seen so far. Some quick questions before we get to going forward, going back. Some thoughts from you guys, because Nebraska really did do when you look at those numbers and nobody knew exactly what they were doing, I'm sure, at the beginning of this, have the data, but were there some things that Nebraska did up front that you think were really important to how well and relatively turned out? I mean, obviously we had a horrible issue around Thanksgiving last year, but were there some things that we did really well that we guys would point out?
Well, I'll start off with that answer, and then Danette can add on her comments too. But I think number one, we had a very good leadership in our governor. So I don't know how many other states have had the hands-on that our governors had on this pandemic, but I want to give the shout out to our governor for taking that role. And then I want to give a shout out to our 19 local public health departments that we have here in Nebraska. We early on recognized the importance of getting the local public health departments involved, and they all stepped up to the plate. And I think it's one of the reasons that we had been a little bit more successful maybe than you see some other states. I think, you know, that we're a smaller state had a lot involved with it. I mean, I could pick up the phone, Brian, and call any CEO of a hospital, any CMO of a hospital, and act like I knew them since I was a child. And that's sort of the attitude that everybody sort of took here in Nebraska. We were all in this together, and we all acted like Nebraskans, and we just sort of worked together as a team. So to be able to work with the CEOs, the CMOs, and to have their cooperation, the public health departments, I think that was what I think was one of the keys to our successes.
Yeah,
And I would, Brian, I would add that I think certainly the leadership from the government, from the governor, has just been paramount. But we've also had teams within our public health division who are analyzing the data and analyzing the science and measurement so that we are getting good information out to the community, but specifically to the governor. There's been a lot of community engagement. You might have heard of our Finishing Strong campaign, where we are doing a lot around educating and just making sure that citizens of Nebraska understand the virus, understand testing, and the vaccination. And again, I concur with Dr. Anthon. If it wasn't for our health systems, FQHCs, local public health departments, as well as we've worked with schools, businesses all across the state, I think our numbers would be a lot higher if we weren't in frequent communication with one another.
Yeah, and I think, just from my own experience, to your point, the way Nebraskans work, I think of that cooperation. You mentioned the meat packers, but the truth about the meat packer situation was how fast both the meat packers and the health officials in this state reacted. It was a tremendous partnership between health officials and business to move quickly there, and also the hospital systems and how well they cooperated together to deal with issues when they occurred. And finally, testing. I'll admit that I was probably one of the frequent flyer testers, because in my job I travel the state all the time, and so I was trying not to contaminate anybody. So I was one of those frequent flyer testers, but it was easy. It was easy to get tested, and it was easy to get in and on a timely basis. Let's talk about vaccination just a little bit. As we get to these younger ages, you know, clearly my age group, I won't tell you how old I am, but I'm clearly in those age groups where most of us will have had the vaccine. I've completed both of mine. As we get to the younger ages, what are our concerns from a vaccination standpoint, and how can employers be helpful?
Well, I think it's important to educate their employees about the importance of the vaccination, that it, again, provides that extra layer of protection. I know some of the conversations that we've been having here in the department is how we might make that vaccination more available or accessible to employers. One example is one of our local public health departments on a day last week had a few dosages left. They called one of the local restaurants to see if they would be interested in having their employees vaccinated, and the answer was yes. And so the local public health department went there and did the vaccination. I would surmise that probably a lot of those staff members were probably young, and so they got vaccinated. I think the more we can educate, the more we can make it accessible, I think the better the results will be for those persons from 40 to down to 16 will be. And of course, we are doing some work with our school systems to make sure that as many as possible, and Dr. Anthon, this might be something you could respond to, that the universities are getting vaccinated, or at least there's a program so that age from 17 to 21 is getting the vaccination. Am I correct about that?
That is ongoing, yes. And just my thought about your question about the younger age groups, or even the middle age groups, about not maybe getting vaccinated as high as a rate as we saw with the older population. You know, we have over 80% of our 65 and plus population vaccinated now. And Danette put some of those numbers out. We're not seeing that quite high of a number in the other age groups. So I remember when masks came out, and people would say, I wear a mask not only to protect me, but I wear a mask to protect you. And I look at getting vaccinated, and we have to get this message out in the same manner. I not only get a vaccine to help me or protect me, but to protect us in the future so these variants can't take over and multiply and maybe cause more reinfection or vaccine breakthroughs. So that's sort of the message that we need to get out. I mean, I have younger children that, you know, could get vaccinated, and they're one of them did and one of them didn't. I mean, I have twins that are 21 years old, and one got vaccinated and one didn't. All my older children got vaccinated, but the one that isn't getting vaccinated said, even if I get it, I'll be fine. But we need to get that message out. You might be fine, but you could get the disease and you could spread it. So I think that's sort of what I hope we can get the message out and get those other age groups up to that level, like we saw the 65 plus age group get vaccinated.
And I think if I heard you right, Doctor, to that point, these variants and mutations will occur until we get to a certain level of either herd immunity and or vaccinations. Unfair question, but is there a rate of percentages you have in mind of when we get to that point of either people that have had it or have been vaccinated that you think the mutations might slow down? And I know we don't know a lot about mutations yet. Yeah,
the one way to slow down the mutations and the variants from multiplying is to get vaccinated, because right now the vaccines cover the variants. So if we could slow down that multiplication of the virus, what percentage do we need, Brian? I don't know. I mean, you hear numbers as low as 65% and as high as 85% of the population having immunity, whether that be immunity through a vaccine, which is a lot better immunity, we know, than having the infection and having immunity from the infection. But I would say in the range between 65 to 85% of the population. And somebody put it this way to me too. Right now we're sort of taking care of our own house. We need to do this internationally too. We're not going to be out of the woods until we get this internationally done. So, you know, we're doing fine here in the United States, I think, but we're not going to be over this pandemic until the entire world has immunity.
And one last quick question. So I've had 2 Modernas. If I do get reinfected at some point, am I still better off in that situation? I'm assuming, I keep reading that the symptoms will be less. I mean, that vaccinations cut my risk. Is that what we're seeing in the data?
That is what we're seeing. So if you've been vaccinated, you know, that's not, you know, the vaccines aren't 100% effective. Even the Moderna and Pfizer are only like 94, 95% infected, are efficacious. So you can still get infected again. But yeah, if you've been vaccinated, I look at it as, you know, your probably illness you're going to get is going to be a lot less severe.
Okay, well, thank you both, and thank you both for everything you've done this year. I mean, I think one of the untold stories when this is over, and this will be over someday, is we're going to go back and look at a lot of people that did a lot of things right during this process, and your department was clearly front and center, and Nebraska owes everybody in our health system a debt of gratitude. We need to keep at it, and in that vein, let me introduce our next speaker. Because we are talking to some employers here, and from an employer-employee standpoint, this has been a long haul, and continues to be a long haul, because I think to really open up and keep people safe and do the right thing, which our employers want to do, they're always trying to keep track of what they can and can't do from an employer-employee relationship. So we're lucky today. We've got a good friend of mine and a good chamber member, Mark Shore from Erickson Cedarstrom. Mark is on our Labor Relations Council and actually heads it for the chamber. He's an appointed member of the American Bar Association's Committee on Development of Law under the National Labor Relations Act. He's always listed as one of the top labor legal minds in the state. He graduated with me from the University of Nebraska, and I won't share any of those stories. Undergraduate, and also JD from the University of Nebraska College of Law. Mark, talk to us a little bit about, employers, employees. We're not out of the woods yet, because we absolutely want people to be vaccinated, and if they are willing, and so what are you hearing from employers at this point, and what are their issues?
Well, thank you, Brian. We've really gone through a transition in the last 12 to 13 months. From a year ago at this time, most employers were concerned about, what do I do if an employee is infected or test positive? What are my obligations in terms of paid leave under the Families First Coronavirus Protection Act and all of the CDC guidelines? How do we reintegrate employees in the workplace? How do we manage employees working from home? And we've really transitioned now to a new issue for employers in terms of what we're seeing. Employers want to know, can we incent employees to get vaccinated? Can we actually mandate that all of our employees get vaccinated? And so what the focus of this topic I've been asked to address today is employers mandating vaccinations versus encouragement and incentivizing employees. And what this really involves is a balancing of interests, and things are a little unsettled at this point, but it's really a balance of trying to balance employee privacy rights and some HIPAA considerations versus the rights of employers to continue to operate their business, and the rights of employers based on business necessity to mandate that employees get vaccinated. And it's much easier in some industries than others, but the primary legal concerns arise under the Americans with Disabilities Act as amended, and what we call Title VII of the Civil Rights Act of 1964, and that is the Base Employment Discrimination Act that covers a variety of types of discrimination, including religious discrimination or discrimination on the basis of religion. And so fortunately, the Equal Employment Opportunity Commission at the federal level, the EEOC, which is the federal counterpart to our Nebraska Equal Opportunity Commission, did issue a very detailed guidance memorandum a few months ago that did confirm the position of the EEOC that employers may require employees to obtain a COVID-19 vaccination as a condition of continued employment under certain conditions. And those conditions are, the employer must be able to show that the vaccination requirement is both job related and consistent with business necessity. And those are a couple of legal terms. And the exceptions to that are the competing exceptions to job relatedness and business necessity come about in that employers must grant an exemption from a vaccination requirement to employees who indicate they cannot or will not become vaccinated because of either disability or pregnancy or a sincerely held religious belief. And so this obviously brings in terms of disability or pregnancy, medical directives from the employee's attending physician as to why their attending primary care physician believes they should not get a vaccination. The other one I mentioned was sincerely held religious beliefs, and that would require the employee to establish that they do practice a particular religion and that they do have the sincere opposition to vaccinations. That's not the end of the question, however, for employers, because employers have a duty to accommodate such situations. That's similar to the duty to accommodate any employee with a particular medical condition or disability. And so under the ADA and Title VII, employers are required to engage in what we call an interactive process with employees who indicate they cannot get a vaccination and determine what can be done to accommodate that employee and preserve their continuing employment. And that would involve such alternatives such as remote working from home, or internal precautions with isolation, flex scheduling. I'm even aware of some employers who alleviate certain concerns with employees who have traveled and come back several months ago, with allowing those employees to come in and work at night when other employees are not present in the immediate area. Well, as far as business necessity and job relatedness, there are certain occupations and industries that we can all think of immediately where job relatedness and business necessity are really self-evident. That would obviously be frontline healthcare workers, other workers in retail, and other types of occupations that have frequent and direct public contact with large numbers of individuals in the general population, restaurants, and really any type of setting where the employer has employees that are going to have a lot of frequent and direct necessary contact. There's a little bit of additional support for employers who want to mandate that all employees get vaccinated, and that is found in the legal standard that under the disability laws, that an employee cannot pose a direct or should not pose a direct threat to the health or safety of other individuals in the workplace. And so that is another item of support for employers in justifying the job relatedness and business necessity for a vaccination requirement. Now, one caveat I do want to point out is that any employer who maintains a union bargaining unit with a collective bargaining agreement would, or very well likely may be required to bargain with the union before implementing a new policy that would mandate vaccinations. And an obvious question in this whole area that I know a lot of employers want to know who are on our program today are, what if employees refuse to be vaccinated? Well, you really need to make it clear what the alternatives to such a refusal would be. And I strongly recommend that any employer who is going to institute a policy of requiring all of their employees to get vaccinated first engage in considerable and detailed communication with those employees in terms of detailing your vaccination policy and explaining why the employer has decided that it is a prudent step to institute a vaccination requirement. You should communicate with employees and make it clear to them how they would go about requesting an exemption from the requirement, and establish a deadline for any employees to indicate that they object to the vaccination or believe they should be accepted from the requirement. You should establish a date by which all employees are required to receive the vaccination, and you should provide clear notice to your employees of any ramifications or resulting discipline for employees who fail to get vaccinated, such as termination of employment. Again, the area of the law is still very unsettled because this is very early in the process, and we are starting to see some lawsuits, and I'll mention that in a minute. But assuming that employers have complied with everything I've talked about here today, they can establish job relatedness and business necessity and make a strong case for why they believe they should have a policy of mandatory vaccinations. Then employers, based on the EEOC's guidance, would be able to terminate at-will employees under certain circumstances. And there are a lot of factors that come into play. Business necessity can be very hard to establish. And of course, employees who are under employment agreements may differ, but if in the absence of an agreement, Nebraska is an at-will employment state, which means without an employment contract that either the employer or the employee is free to terminate the relationship at any time with or without notice, so long as the employer doesn't run afoul of any of the discrimination provisions in the various federal and state anti-discrimination laws. And those, of course, you have to treat employees similarly. We could have a whole day-long program on all that. But as I mentioned, this isn't something to be taken lightly. We are starting to see some lawsuits, in particular, one down in New Mexico, which involved an employee of a public employer. And that employee did bring a lawsuit seeking to bar the employer from requiring the vaccine or taking any negative employment action, asserting that the vaccines were unapproved medical products, in that there was an emergency authorization, but that the vaccines did not have complete authorization, and claiming that making someone get vaccinated would actually constitute a retaliatory discharge. And because this was public employment, that employee alleged that it would violate his due process rights. There are other rules that apply to public employment, as any of our public employers who are participating here today readily are aware of, and that is that certain public employees may have property rights in employment and an entitlement to due process. The flip side of requiring the vaccinations are we are seeing a lot of employers wanting to grant incentives to employees to encourage them to get vaccinated. These incentives can take on a variety of forms, including bonuses, gift cards, or other benefits. The EEOC has expressed a little concern that such benefits or bonuses should be kept at a very minimal or de minimis level to avoid certain potential claims of discrimination, that there's discrimination against those who may have a medical or religious reason not to get vaccinated, who would then be treated less favorably than the others, and some potential there for unequal treatment of salaried exempt people from non-exempt people. But again, that's kind of a minor consideration. Finally, before we open it up for questions, I want to call everybody's attention to the fact that under the recently enacted American Rescue Plan Act, or what they call ARPA, employers that voluntarily provide paid leave to their employees do qualify for a refundable tax credit, somewhat consistent with the refundable tax credit that we saw last year under the Families First Coronavirus Response Act, for giving employees up to 2 weeks of paid leave under certain circumstances. And so if you are going to do that and try to avail yourself of that tax credit, it would be advisable to have a policy, or if you already have a policy on paid leave, you may want to amend that policy and add paid leave for time off to receive a vaccination, so that you have that commemorated in a formal written policy. That's a brief overview of what I was asked to present today, and those are the highlights with the time constraint we have here today. And with that, Brian, I'd open it up to questions.
Yeah, so Mark, I've just got a few questions for you before we wrap this up. One, I mean, first of all, I do have a appreciation for people that are, as they think about vaccines. So my wife would tell you that I'm one of those who, I refuse to take pills. I refuse to take anything. My dad never went to the doctor until the end and lived till he was 97. And so I think I've got some of that Western Nebraska viewpoint on things. In this case, though, the two things that clearly got me over the hump and why I took the 2 doses was, one was Dr. Anton's conversation about the mutations and variances. We've got to get to the end of this thing. And so in some respect, this is my part of trying to get this state and this country to the end of it. And then the other part is my job as state chamber president requires me to be out and about and amongst people all year long. And part of it is I need to be part of the solution. I mean, it just goes with my job. So my sense of it is to get people who are normally reluctant to take anything, including vaccines, is an education process. So long-winded way to get to the question, but can I, as an employer, mandate an education that all employees get an education on, you know, something like Dr. Anthone just presented. Here's the statistics, here's the data. You make your own choice, but here's the data. Can I mandate they attend an education session?
Oh, Brian, you can provide education and require employees to attend as a legitimate job requirement, provided, of course, that you have to compensate them for any educational type session or training session that you are mandating, where you're mandating their attendance. But no, I think that's very similar to all kinds of education that employers provide their employees. I echo what you said. I understand there are a lot of people who, for one reason or another, don't want to get vaccinated, or they don't believe this is serious. I suspect a lot of those are people who don't know someone who unfortunately passed away due to COVID-19, or don't know someone who has lingering effects. I appreciate the fact that you got the vaccine. I will say that I am now partway through my remarks. I crossed over T-minus 24 hours until 2 weeks since my second dose of the Pfizer. So I'm looking forward to that. And everyone in our firm, I believe, got the vaccination, and we didn't have to mandate it. And but yes, you can require an education, and I would encourage employers to educate employees on why it's important to be vaccinated.
So let me ask you a hypothetical, which is always an awful unfair question, but we've had a lot of workers go remote during this period of time. And now a lot of employers are trying to bring back their employees back as they open for business. And I think about, you know, particularly retailers and people where the business is clearly a job site. And so remote work really is not a long-term solution. If I've got an employee and they refuse to take the vaccine, and I'm in one of these business necessity situations, and they say, I'm not going to take the vaccine, but I insist that you continue to employ me remote. And so now we've got two questions: the ability to work remote versus the vaccine. My sense is the important thing is to make sure that you communicate policies, and to your notion of you really communicate what the policies are and why up front. But any thoughts for employers there as people argue, I don't want to take the vaccine, I just want to stay remote?
Well, Brian, that raises a whole host of additional issues, and they really, the answer to that question really bottoms on, is the position in which that employee is employed conducive to being remote for an extended period? Now, obviously, a number of us had to look at situations, and I have a lot of employer clients that, you know, could easily have people work remote. And in certain industries and certain occupations that works, but the legal standard is that individual able to fulfill the full range of required duties and responsibilities and all essential functions of that position without being present in the office? And if an essential job requirement and function or duty of that position requires that employee to be present in the office, then you as an employer can require them to be present in the office and say, no, working remotely is not a workable solution on an extended basis.
And one last question, Mark, which is, let's say that I've got 100 employees and 96 of them get vaccinated and 4 refuse. And we're all in a workspace together. But the four who don't get vaccinated are perfectly fine coming back to work, and in fact have worked during the pandemic. From a HIPAA standpoint, if employees come to me and say, I want to know who gets vaccinated and who's not vaccinated, I assume I can never say that. What does an employer do with a group of employees who've not been vaccinated? Can they treat them any differently, or is it really important not to treat them differently?
It depends what your policy is, Brian. Is this an employer that said we're going to mandate the vaccine and we're going to give clear notice to everyone? And if you don't get vaccinated, you know, you can't work here anymore. You're correct. HIPAA does prohibit you from sharing medical information regarding one employee with other employees. And so these are the competing interests in the balancing that I pointed out at the start today. And the law isn't totally settled yet, but you know, it's basically a comfort level. And I know of situations and very acutely aware of situations where groups of people, even before the vaccine was available, all agreed we're all going to come into work. We're going to wear masks. We're going to use hand sanitizer. We're going to be here in the workplace. We're going to distance. And so there are ways you can accommodate that situation, but it's up to the employer what they're going to do if that small group of employees refuse to get vaccinated.
Well, Mark, thank you. And I violated my own rule, which is never let two lawyers close a program, because that's no way to close any program. But here we are. Thanks, Mark, for doing that today. This has been incredibly important. It's incredibly important for employers, employees. And while we've talked about a lot of legal issues, here's what I do want to say is over the last year, what I've observed among our employers and our employee base in Nebraska was incredible teamwork and cooperation, regardless of anything else. It's what makes Nebraska special, as was indicated by Dr. Anthony at the beginning. This is a very special place, and whatever differences we have and whatever issues we have, just outstanding work on the part of people of this state, including our employers, our employees. And I want to thank Net, and Dr. Anthony today, and everybody who helped make this presentation. Hopefully this was helpful to our members, our employees, and employers out there. And so we still got a lot of work to do, but appreciate everyone's help, and I hope this was helpful. So with that, I will close and wish everybody a good day.